Welcome to This Week in Health IT, where we amplify great thinking to propel healthcare forward. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. We have a live episode this week, Friday from 11 to 12 Eastern Time. We're going to talk about funding telehealth's future with a great panel and your questions. Marie Savekis, Chime Public Policy, is going to really spearhead the conversation. We have Praveen Chopra, CIO for George Washington University, Dr. Stephanie Lahr, CIO, CMIO for Monument Health, and Albert Oriol, the CIO for Rady Children's in San Diego, as rounding out the panel. I'm really looking forward to this. I think it's going to be a phenomenal conversation. If you're wondering what the future of telehealth funding is going to be, you're going to want to tune into this and interact with our panel. Mark it on your calendar, invite a friend. Let's make it a party this Friday, 11 to 12. This episode and every episode since we started the COVID-19 series has been sponsored by Sirius Healthcare. They reached out to me to see how we might partner during this time, and that's how we've been able to support producing daily shows. Special thanks to Sirius for supporting the show's efforts during the crisis. Now, on to today's show. All right, this morning we're joined by Chad Brisendine, CIO for St. Luke's University Health Network. Good morning, Chad, and welcome back to the show.
Good morning, Bill. Thanks for having me.
It's always good to catch up with you. As I've alluded to before, the St. Luke's is where my parents actually go for their health care, and my father was actually in the hospital there in the last couple of weeks, and he's doing fine for anyone who's thinking of asking. But his experience was great. I appreciate all the work that you guys are doing. The digital experience was great. The medical record has moved back and forth between California hospitals and a bunch of Epic hospitals. So you guys have done a lot of great work with regard to the EHR and digital and other things. So I really appreciate that.
Well, thank you, Bill. And I appreciate you dropping me a note and letting me know about his experience. I sent that to our president of our Anderson facility, and he was grateful for you doing that.
Well, yeah. So here's what I'd love to talk about. So my parents, we had the conversation of what their experience was like, during COVID, and it's interesting how people are experiencing this. And what I want to start talking about with health leaders like yourself is what's it going to look like post-pandemic. I don't want to get too far ahead of ourselves. I realize there's still a lot of work to do right now, but this is how a podcast goes, by the way. The lawnmower comes right by the window right when we start the podcast. But
I'll probably have a plane land in the backyard over here, I'm sure.
But not to get too far ahead of ourselves, but I do want to start to explore what this is going to look like as we come out of the pandemic. But before we get there, I want to hear from you how you've experienced the pandemic thus far. Just give us an idea of what you guys did, how you experienced it.
Yeah, sure. So as you know, Bill, we're in the eastern PA side, so we're very close to Jersey. We actually have one facility in Jersey. And as you know, Jersey, New Jersey, and New York, obviously the hardest hit in the country. So we have a lot of traffic come up to one of our hospitals in the Poconos because it's a resort area for the folks in New York City, so they travel there a lot. So we got hit harder there earlier because we have a lot of back and forth New York City traffic. So one of our campuses, the Monroe campus, saw the earlier signs of the patients, and really their volumes peaked out pretty high for us at that one campus. And then we began seeing it kind of migrate down. As you know, my role is beyond IT. I also have supply chain, radiology, and some other departments. So my primary task for the organization was to set up a virtual command center. So that was literally like early March that we began doing that. And then my second focus was around PPE with the supply chain focus. And one of the things we had was a lot of limitations around our systems. So we really needed to do a couple of things. One is figure out our surge capacity plan, figure out our PPE capability, and then make sure that we're managing our labor through that process. And so those were kind of the roles. And we reacted very quickly. We're able to set up a lot of, we ended up building actually a lot of custom technology with some of our power apps and low-code technology and stuff like that to augment what we had around all that. So it was a really nice setup. But we really saw kind of a peak. We put a bunch of different, our strategy department put a bunch of different models together. We're very fortunate that none of those models end up hitting where they were at. We peaked out at about 300 inpatient COVID patients per day. And now we're down to around 100. And, we saw testing go from 5 to 6 days at the beginning of this to now, less than half a day. And most of our testing is within a few hours. One of the other things we saw around COVID was we've seen some other organizations have higher infection rates among their employees. Ours is less than 0.5%. And I really think it's a combination of our PPE guidelines that we were able to have, and we were able to have the appropriate amount of PPE because I think we were able to source unknown suppliers very quickly that were external, not within our GPO, to be able to get alternative products. So that's probably more than you wanted to know, but if you have any additional questions, I'm more than glad to spend some more time on that. But obviously, very unique situation, and
you have such a unique perspective because you do have, you do have supply chain, and you do have some service lines, which is kind of interesting. And we've talked about that before on the show. We also talked about your low code environment, which I think is really brilliant for other CIOs to consider. I mean, the ability to configure things and put apps out there very rapidly, so people can go back and listen to some of those shows. We've talked about those before. But I want to really explore the IT side a little bit. So, we saw huge gains in telehealth. We did a lot of stuff to conserve PPE by using video and whatnot. As you consider some of these things, how do you think those will be integrated in our post-pandemic work models?
Yeah, so just a little bit around our virtual care. So, you probably saw the Microsoft Teams video with St. Luke's University Health Network in it that was played nationally. And as you know, we've had a Microsoft partnership for a couple of years, strategic partnership with them. And we had done a lot of the foundational work activities around the platform prior to this as redefining our entire communications infrastructure within St. Luke's. Kind of think of it as the EMR, but redefining communications in a platform like thought process. So what we really saw is an increase, obviously, in virtual care. So our primary care physicians and our specialists began leveraging that. What was very unique is the phone calls were, at the beginning of it, the number one used virtual platform, right? And then what we began seeing is it increasing to Microsoft Teams. And, we did in our first month 100,000 virtual care visits. So, which is, we are basically doing 75% of what we normally see in a practice virtually, which was amazing. And I can answer questions. There's obviously a lot of hurdles around that we experienced, but pretty amazing to see our organization flip that quickly.
So do you think, we talked a little bit prior to this, CMS has sort of stated that we believe this is the future and we're going to continue to fund it as such. And typically the commercial payers follow. So if that's the case, are you guys all in at really transforming from maybe a physical to a virtual for a bunch of this stuff?
I mean, I think the payment model is going to be the key thing for us. If payers will pay, we'll be all in. If they don't pay, I think we're still going to have to be in. The question just, is it all in or not? And I think that's where I kind of go back and forth between all in or halfway in, if you want to call it.
This is why I love talking to you. You have business line experience, so you think and talk like a CIO should in terms of really understanding the business aspects of it. How have you experienced work from home at this point? I think we anticipated a significant drop off in productivity, but from what I'm hearing, we haven't really had that. So how have you guys experienced it, and what are some of the things you guys did?
Yeah, I mean, we definitely, obviously, I'm sure like most organizations have supported a virtual capability. I mean, with the technology that we're using today and other technology similar to it, we're obviously the Microsoft shop. We've been able to really improve communication and collaboration. We used to, and you've spent some time with me at St. Luke's. We would always call it the St. Luke's 5, and that basically meant we were always 5 minutes late to the meeting. Well, that was because we were having to physically go every place. Well, I've been on so many on-time meetings in the company's history. It's just amazing to see. So I know that I'm getting better at I get better at that. And then I've really seen a reduction in the time in which people want to spend on a meeting, like 15 minutes, a lot more 15-minute meetings and stuff like that, just a quick pop-in or a check-in. So I've really seen the communication change. I'm also working on a project with Microsoft right now. There's a product called Workplace Analytics that we're running right now to look at the pre-COVID, how we worked from a communication and collaboration perspective to post-COVID. So I hope maybe I can come back and share some of those results with you because we'll have all the data from Teams, Outlook, tasking, project, all of it to kind of look and see how our work transformed during this. I'm very interested to see how that's changed.
Yeah, love to do that. So today is May 22nd. I'm going to put the date in here, even though we'll air it a couple days later. But the reason I'm doing that is because I want to talk about what your priorities are today, and I want to make sure that that the date is in there. So from a health IT perspective, what do you think your priorities are right now, and what they'll be post pandemic?
Yeah, I mean, we're just coming off of rolling down our command center, our virtual command center, and also really pulled back on where we've got a nice, healthy supply of PPE. So we've kind of what I would consider, stabilized the pandemic, if you will, and we see the numbers coming down for us, and that's just as of recent. So now, obviously, I'm getting a lot of the requests like, where's my project, or where's this, or where's that back again. So that's started to ramp up. So I think we're going to be going back through all of our projects, and we're really looking at what we keep versus not. But whenever I think about what we're going to be doing over the next 6 to 12 months, if payment, well, with or without payment, we're going to continue to optimize virtual care. Depending on how much the payment transitions, I think will depend on the size of investment that we decide to put in it. So, we'll be putting a business case around virtual care, looking at all the scenarios and really determining how that's going to change. But we do know, we've already been doing, we always are doing cost reduction strategies within healthcare. I think there's, a pandemic highlights the need to do that even more. So we'll continue looking at labor efficiencies and ways to be more efficient at delivering care. And I think that this is obviously put an additional lens on that perspective. And then we'll obviously continue. We've been, and you've helped me do some work around this, continue investing in our digital front door. That work is never done. And we'll continue to try to make that as efficient and as high. My goal with the self-service is until we get to 100% self-service rate on every one of our transactions, we're not done. I'll probably, unfortunately, pass away before I ever see that happening, but I'm going to keep, the energy and the focus on making all of our transactions as easy as possible for our consumers and making sure that, until every single one of them does it in an efficient, easy manner for them, we're not done with that work. So that's probably the 4 or 5 buckets of categories that we have going on within St. Luke's.
Wow. Oh, well, you have a lot going on. We're starting to see signs of life. We're seeing the claims data grow. The Monday claims data is growing in volume across the country, and even in the Northeast, it's starting to grow. What kind of things is your health system doing to expand those procedures at your health system at this point, either from a safety standpoint or from getting the revenue stream back? Yeah.
So we began elective surgeries. It's the 22nd, so I guess 2 full weeks. And we're probably back upwards of around 85% of our revenue back through the month of May, where we saw it dip. Obviously, we took a couple of brutal months, I'm sure, like many other organizations, but we've seen it start to pick back up. So I'm very hopeful that we get stuff back up in June. Like in June, we see a nice full month of healthy volumes. What's interesting is there's a backlog. People don't just stop getting sick. They tend to avoid things. And so then the question is really what impacted people's health by not taking care of the things that they have, and how has that impacted them with or without the benefits coverage? So I think what's going to be interesting to follow is, this unemployment rate at whatever it is, 40 million people, what benefits have that impacted people? And then how does that compare to their need to get their health done? It's going to be very interesting. But I see our surgeries backed up. I mean, man, we were already on a backlog. Think about how big the backlog is now. So there's going to be a lot of volume, I think, that we have. A pent-up demand, I guess is what I call it.
Yeah. So how are you planning from a health IT standpoint to plan for a second surge? There's a lot of talk about this. In the fall, we might see another surge as we start to open up. And most pandemics actually do have multiple spikes. Are you guys talking about that, planning for that?
Yeah. So I guess I'll answer it from my role perspective. So to me, primary front and center, even though I'm the CIO, is making sure that we have appropriate PPE and supplies. So making sure that we have a healthy log of all that. So that's my primary focus. My secondary focus is making sure that we get the physician's feedback, which we've already done, and begin enhancing our virtual care process. So we are already on the path to do. So those are probably my top two things that I see really that needs to occur for the second wave of this.
Yeah. So what's your greatest learning so far?
You know what? We implemented a kind of a, and you're probably familiar with it in a development world, but kind of a squad mentality for solutioning. And we put like pods of people on different types of things. And one of the things that I really wanted to do before this was give my other teams the ability to do Lowcode and other types of projects, like the Epic analysts and stuff like that. Teach them how to do, not necessarily build code, maybe eventually, hopefully, but get more skilled up into other platforms. And that's probably the one thing that I think that I've really enjoyed watching my team do is be willing to pick up all these additional skills and just jump in. And I think coming out of this, they're going to have, multiple, if you want to call it, technologies on their belt, and that's really going to help them. So that's the positive thing that I think at least the IT team have really picked up on through this.
Well, Chad, I'm sort of laughing because I appreciate you taking the time, but I think I went over, so you're probably going to be 5 minutes late for your next meeting.
Oh, that's all right.
All right,
happens.
Always good to catch up. Thanks.
Yeah, hey, thanks, Bill.
That's all for this week. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, HealthLyrics, Sirius Healthcare, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, most of you can say this now without me even finishing it. The best way to do that is to share it with a peer. Stop right now, send an email, tell somebody, hey, this is a great show. I'm getting a lot out of it. You're going to want to check out these interviews and conversations. The second best way you can do it is you can subscribe to our YouTube channel. We're putting an awful lot of new stuff out there, and it's exciting. The live show will only be available on the YouTube channel. It will not be dropped into the podcast channel. Some of you asked me to drop it in last time, but my team here internally wants me to stay focused on the strategy, and that is to have content that is specific to YouTube and to start to diversify our channels, if you will. So some of our content will only be available on YouTube. So get over there and subscribe so you know when it's available. Please check back often as we're going to continue to drop shows on a daily basis through the end of June or until we get through this pandemic together. Thanks for listening. That's all for now.